To our regular programming for today's briefing from the South Korean health authorities. As we wait for that to begin, we do expect to be getting some analysis of the latest figures on the coronavirus in Korea. Also, the authorities have decided to raise the level of social distancing in the Seoul area to level 2.5. We have been at level 2 for some time, and so that means already that coffee shops are takeout only at night, restaurants are only takeout and delivery. Now, there have been new measures enacted in the previous 2 days, but we'll be getting some more details on the new measures here in the briefing. Now, the number of coronavirus infections in South Korea does continue to surge. The country on Sunday reporting 631 new cases, an increase of 48 cases from the previous day's number. This is the third highest number of daily cases since the start of the pandemic, and the number has been in the triple digits for 29 straight days. Let's cut to the briefing now and listen in.
I am the first Vice Head of the Central Disaster and Safety Countermeasures Headquarters, Minister Bang Neung-hoo. Dear citizens, today, under the leadership of Prime Minister, we have held a meeting and we have taken a look into the situation of COVID-19 in the metropolitan area. We have said that it is at a big resurgence right now, and right now we are at a very dangerous situation where it could break out to a massive outbreak, and we are just before that. And as a result, we have decided to elevate the social distancing to level 2.4 for metropolitan areas, and also for the non-metropolitan areas, we have decided to elevate the level of social distancing to level 2. From until November 30th to until December 6th, we have seen 514 average daily cases newly confirmed, and of these, 470 were from the metropolitan areas. And until now, we have seen that the newly confirmed cases have been more than 400 for the past 2 weeks until today, and we believe that the number has exceeded the level of social distancing that we have imposed before. And for the non-metropolitan areas, we are seeing less. However, there is a gradual increase in newly confirmed cases. And also for the infection reproductive level, it is higher than the 1.2 of last week, and we believe that this could be higher in the future. Until now, we have taken a higher level of social distancing. However, we have not been able to see the effect until now. And over the past 2 weeks, the movement of our citizens have decreased. And right now, it is at the lowest level that we have seen in August when we saw a big resurgence. We do not see the effect of the elevated level of social distancing yet. However, we hope that it will be effective, but we think that the effect may be limited for the near future. And as of now, we are seeing the infection spreading through our daily lives, and that is a reason why it is difficult to analyze the reasons for the outbreak. And right now, it is exceeding the level that we can control in our hospital systems. And also, the number of critical and severely ill cases have increased. Until now, we have taken efforts to increase the number of hospital beds, and we try to secure hospital beds so that people can be immediately entered. And we still have more than 20 left in the metropolitan area. However, if we continue with the trend of the increasing patients that we see now, we will face a shortage in the hospital beds, and this could be possible in the future. And also for the life treatment centers and for hospitals, we still have room for additional patients. However, if we see the current trend continuing, then there could be limitations here as well. Right now, fatality rate in Korea is at 1.45%. And this is lower than that of the global numbers. And this is thanks to the capability of our hospital systems and the efforts of our hospital personnel. However, if we face a shortage in the hospital beds, and if we cannot control the hospital system, then it will lead to a fatal situation. As we see in many cases across the world, we could see a paralysis in the hospital system, and this will not only affect the patients of COVID-19, but for other illnesses as well. Right now, we are entering into a massive outbreak, and we have to make sure to curb this from becoming a countrywide massive outbreak. And in order to do so, we have to make sure to thoroughly follow measures and apply it. Therefore, the government today, through the meeting, has decided to elevate the level of social distancing to 2.5 for the metropolitan area and 2 for the non-metropolitan areas. And for the non-metropolitan areas, there are areas that have applied level 1 social distancing until now. However, considering that the situation is very grave in the metropolitan area, we are recommending the local governments to apply level 2 social distancing for the non-metropolitan areas as well. However, the local governments can make the necessary adjustment based on their discretion. And we have accepted many opinions of the experts, and most have agreed with us. And I will explain further about the level of social distancing in the metropolitan area. For level 2.5, this is actually recommending people to having any social activities unless it is really crucial. Right now, we have to make sure to follow the preventive measures. And right now, we have to make sure to limit our actions and refrain from moving. And that is the recommendation that we are making so that we can minimize any movement. And therefore, we're going to stop operation for the multi-use facilities, and we'll be expanding these measures. And also, this will include singing rooms, health, and sports facilities, and billiard balls. And also, we are preventing door-to-door sales, and also for private institutions as well. And for PC cafes, libraries, and for the big marts, operation will be prevented from after 9 p.m. For restaurants, only takeouts and packaging would be allowed for after 9 p.m. And for concert halls, we will impose 2 seats being vacant in between people, and also we will apply other measures. And for the public facilities, we're going to stop operation, and for other facilities, we're going to limit operation for 30% of the capacity. And for welfare facility, we're going to continue operation for the vulnerable class. However, we're going to restrict some measures as well. And for the cases for the indoor facilities, we're going to limit it to 50 people, and we're also going to apply mask wearing for outdoor events as well. And for weddings and funerals and etc., we're going to limit the number of people to less than 50. And for parties and etc., we're going to limit it from being happening regardless of the number of people attending. And we also want to ask the private companies to participate in remote working and working at home. For remote classes, we're going to expand the number of the classes so that we can limit the number of students attending schools. And for gatherings, we're going to refrain people from having them. And especially for the metropolitan areas, we also ask people to minimize any business trips or travel so that you are prevented from going to other cities. And therefore, we're going to limit the number of tickets for KTXs and other transportation to 50%. And for the non-metropolitan areas, the level of social distancing will be level 2. And please refer to the press release documents for the details. We will have 1 day of preparation, and this will be imposed for 3 weeks starting on the midnight of Tuesday. And for these 3 weeks, we're going to thoroughly follow social distancing, and we hope that we will be able to decrease the number of newly confirmed cases on a daily average to 150 to 200, and that is our goal. And when we see this result, then we will make the necessary adjustment to the level level of social distancing. We do believe that a lot of small businesses and the business owners will face difficulties. There will be around 130,000 businesses stop operating, and also there will be limitations for other businesses as well. Until now, with the outbreak of COVID-19 and the extended social distancing, a lot of people have seen the effect, and we want to apologize to you for imposing you on this once again. However, we cannot take any steps back, and it is different from the crises that we have faced until now. Right now, we don't have any areas where we have to focus our preventive measures on. If we become lax, then we may see an effect that is bigger than anything that we have seen before. And if we face a limitation with our hospital system, then this will negatively affect everyone in Korea. And through the severe measure for level 2.5 social distancing in the metropolitan area, we hope to see the effect, and this is the last resort that we can take. However, for the cluster outbreaks that are happening across many places, it cannot be taken care of with the efforts of the government alone. We need the voluntary and active support of our citizens, and this is more important above all. So we want to ask you to participate as well. So we are not saying that we are allowing activities. For instance, for restaurants, we are limiting people to be seated in the restaurants until 9 p.m. We are not saying that you can freely go to the restaurant. We are only allowing it for people who have difficulty eating elsewhere, and we are asking others to refrain from eating in these restaurants otherwise. And we are also asking people to refrain from having any types of social activities that are happening outdoors, and please refrain from having contacts with others. Thankfully, some of the vaccines are being developed in Korea, and we are seeing good news in Korea and abroad. And we believe that this will be the last crisis that we face before the vaccine comes out. So it may be the last effort that we have to make, and we want to ask you to do your utmost. And the government will also strive hard so that there are no problems. We're also going to make sure to concentrate so that we can secure more hospital beds as well. And of the hospital beds assigned by governments, for those assigned to the critically ill, we're going to secure more so that we can have more people hospitalized if they are critically ill as well. And we're also going to support the number of hospital beds so that we can expand the number of hospital beds as well. And right now, we have 177 hospital beds assigned for COVID-19 patients, and we're going to expand this number to more than 200, and we're also going to continue to secure more later on. Lastly, I want to ask you this once more. This is the last opportunity for us to curb COVID-19 from breaking out into massive outbreak, and especially in the metropolitan area, it is a very risky situation. So we want to ask you to follow these 4 items. First, refrain from going outside unless it is necessary. Please stay at home. And please make sure to cancel any gatherings or reservations that you have. Secondly, please refrain from visiting any closed, confined places where you can contact other people, especially those that are crowded. And please refrain from any places where you cannot wear face masks. Thirdly, please stay at home if you feel unwell, such as fever or coughing, and please refrain from going to school or going to work, and please make sure to be tested as soon as possible. Right now, we have seen a big increase in the number of cases, and if you have any symptoms, please make sure to be tested. Fourthly, please make sure to wear face masks wherever you go, and also please make sure to practice your personal hygiene, such as wearing face masks and washing your hands. And we believe that we can only curb this infection through the help and the support of our citizens. If our citizens work together with us, we believe that we will be able to overcome this crisis, and we are very confident about it. It may be very difficult, but we ask you to cooperate with us for the next 3 weeks. The government will also retain a sense of crisis and cooperate together with many public institutions and strive hard. Thank you.
예, 지금부터 질의응답 시간을 가지겠습니다.
And that'll conclude our coverage of this briefing. Thank you for watching. Arirang News will be back at the top of the hour.
Mandatory mask wearing to prevent a resurgence of COVID-19 cases. Wearing a mask is now mandatory